Many of you have chosen to be covered by a Medicare supplemental plan, which I think was a great choice. And if you were going through lung cancer treatment, the average cost is $282,000. In this video, I'm going to show you the difference between the worst supplemental plan versus the best supplemental plan if you had a $282,000 bill. Now, I want to begin this video by talking about some of the common causes of high medical bills. In other words, these are health conditions that people get diagnosed with and, of course, have to go through treatment for. Again, there's plenty beyond this, but here's actually the top 8 leading causes. So number 1 would be heart disease, costing in America $555 billion a year for treatment. Diabetes is $245 billion. Cancer, $225 billion a year. Obesity, $210 billion. Kidney disease, lung disease, $170 billion. Look at arthritis, cost of that $80 billion, and then stroke would be $40 billion. And again, there's plenty of other conditions beyond this, but these are your top 8. Now, what's interesting to me about this is that when you total this up, folks, this is $1.7 trillion a year that is spent on these kind of medical conditions. No wonder there is $220 billion of medical debt that's spread among Americans today. Okay, $220 billion. And the second largest holder of that debt would be people that are Medicare eligible, in other words, 65 and above. All right. And in fact, right now we know that medical expenses is a leading cause of bankruptcy for people 65 and above. And the reason, because they get diagnosed with these kind of conditions that are very, very expensive. Now, we could look at all those individually. We don't have the time to do that. So what I'm going to do in this video is we're going to specifically look at a cancer case, and specifically lung cancer. As I said in the opening, that lung cancer is the leading cause of cancer deaths in America. And remember, cancer is the second leading cause of all deaths in America. And so a tremendous amount of people die every year, of course, with lung cancer. So those who go through treatment on average are going to spend $282,000. You can see leading cause of cancer death, also the most expensive as well. A couple other stats here, as you can see, someone that gets mesothelioma, average case is $150,000 for treatment. A lady with breast cancer, $101,000. Colorectal cancer, $165,000. Bladder cancer, $187,000. Skin cancer, $48,000. So any form of cancer is going to be extremely, of course, expensive to have treatment. But we're going to focus in on lung cancer, since it's the leading cause of death of cancer today. All right, so you can see where we came up with a $282,000 bill, average cancer patient that has lung cancer and goes through treatment. And so in our example today, we are saying that this is a person that chose to stay in traditional Medicare, and they got some type of a supplemental plan. All right. And so what that simply means is that when they you are using their Medicare, the A and B is going to pay first, and their supplemental plan is going to pay second. All right, so we're going to talk about the A and B, and then we'll talk about the supplemental plans as well. So when someone enrolls in traditional Medicare, the Part A of Medicare is the inpatient side of Medicare. This covers the hospital, this covers skilled nursing facility, and this also covers hospice. Okay, when someone's been diagnosed with a terminal illness. The B side of Medicare is everything that is on the outpatient side, as well as all doctor services. Okay, that means primary care doctors, specialists, but also surgeons. You have a surgeon in the hospital, that doctor is still paid to the B side. The anesthesiologist that was in that surgery is also paid to the B side. So all physicians, surgeons, anesthesiologists, hospitalists, ER doctors, they're all paid through the Part B of Medicare. Okay, so it's inpatient and outpatient. All right, so as we talk about Part A and B, you also have to know that each of these are going to cover medications while we're in the hospital or while we're in an outpatient type of a setting. So all professionally administered meds are paid through Medicare A and B. B also pays for durable medical equipment and home health care after some kind of an outpatient type of situation. So those are the two different parts. And so financially, here's the way it works. If I go to the hospital on Part A, I'm responsible for a deductible. Now, this deductible this year is $1,632, and this is all I have to spend for a hospitalization up to 60 days. But if I'm discharged, and let's say I go back in the hospital 3 or 4 months later, I come back in, then I'm going to have to pay that deductible again, because the A deductible is tied to a benefit period. It's not annual. All right. So you got to keep that in mind as we go through our scenario. So it can be more than once in a year. Now, if I'm in the hospital longer than 60 days, month 3 costs me $408 a day. Month 4 and month 5 will cost me $816 a day out of my pocket. Okay, these are called extended hospital stays. They're pretty rare, but when they happen, as you can see, they're pretty expensive. Now, when it comes to skilled nursing facility, this is inpatient rehab. Again, this is when someone needs some serious rehab after a surgery or maybe some of their illness or an accident or something. And so Medicare says as long as we've been in the hospital inpatient for 3 days, they cover everything for the first 20 days. Doesn't cost us a penny. But after that, we have to pay for the next 80 days while I get skilled nursing care. I'm responsible for a daily copay to the skilled nursing facility of $204 a day. All right, so that's the A side. The B side of Medicare, we have a deductible. Now we have a deductible, but here the difference is B side is just once a calendar year. Okay, we meet it once a year, $240 this year in 2024. Don't know what it'll be in 2025, but it's usually very small. So this can happen multiple times. That happens once. After I've met that small deductible, then Medicare is an 80-20 plan. Medicare pays 80%. You are responsible for 20%. Call it coinsurance. Okay, and so that current coinsurance is 20% of the bill that you have to pay. And then lastly, Medicare allows doctors to treat Medicare patients and to bill Medicare, but that doctor is not obligated to accept what Medicare says we will reimburse you for. Those are called fee-for-service rates. And so there's some doctors that say, I'm not going to take that as payment in full. I am going to add to the bill, and when they add to the bill, they add 15% to it. Now, less than 5% of doctors are going to do this, but it does happen. And so if it does happen, if and when it does, you would be responsible for that. And so what I'm trying to teach you with this little grid here is that these are your responsibilities. These are the gaps in Medicare. These are the liabilities that Medicare says are totally on you. So that when someone has an A and B only, they would be responsible for every single one of these gaps, and there's never a stop-loss limit to it. It just keeps going and going and going and going. Most people don't want to be responsible for the gaps. It's too much liability. They're uncomfortable with that. I would be too. And so what they're going to do, instead of being responsible for the liability themselves, they're going to go out and they're going to buy a supplemental plan from a private health insurance company. And that private health insurance company will charge them a premium to take these gaps, some of them or all those gaps from them. So that's what supplemental plans are all about. We also call these medigap policies. Now, there's 10 of them on the market today. Medicare has revised this system since 1965. They've revised it a few times, but these are the present plans that are available, represented by an individual letter. So we have 10 different possibilities on the market today. Now, what's important to note is that all these plans are what we call standardized by Medicare. Medicare does what? Medicare sets all the rules for coverage. Okay? Medicare doesn't set the premiums, doesn't make the companies offer all the plans in any given market. There's rules that the state may have, but as far as coverage, what bills are paid, what type of bills are paid, and the amount of bills are paid, Medicare standardizes those rules. So that the consumer can look at a G plan, whether they're buying the G plan from ABC Insurance Company or they're buying the G plan from XYZ Insurance Company, the coverage will be the same. Identical. The same bills are paid by each company, the same type of bills and the same amount of bills. There's no difference whatsoever. Now, beyond coverage, there's difference. I guarantee you the premiums are going to vary from company to company. The stability of the rates are going to vary. The ratings of their company are going to vary. Customer service varies. There's a lot of variables. But as far as coverage, it's identical because Medicare says these plans are standardized by us and will dictate what bills are paid and not paid. All right, so very important to understand that as well. So in my example today, what we're going to be talking about is how each of these different supplemental plans is going to take care of that $282,000 bill. What are they going to cover? And what are you going to be responsible for? And we're going to, again, go from the worst to the best, and I'll close out with showing you the top 3 plans that are on the market today. All right, so let's talk about the scenario that we're going to use to show you the differences from worst to best. Okay, so again, obviously we got this bill, average $282,000. So what we're saying here is this particular person gets cancer, lung cancer, and what happens is they are going to be in the hospital 2 times, okay? And they say right now that the average person that's getting lung cancer is actually in the hospital 3 times. So we just want to put some very realistic numbers before you. And so what does that mean? That means that they're in the hospital, they're going to be responsible for this deductible 2 times. That's $1,632, okay? So that's one part of it. They're in the hospital 2 times during treatment. Number 2, This person also, after their surgery, had to have some pretty intensive rehab, and so they went to a skilled nursing facility. Again, not uncommon at all to go to rehab after this kind of a situation, injury, illness, accident, disease, all those kind of things. So what we're saying is this person was in the skilled nursing facility for 30 days. 30 days. Right now they average between 30 to 35 days. And so we said as long as they had a hospital stay of 3 days or longer, they didn't have to pay anything for the first 20 of those 30 days. So what's happening? They're only having to pay 10 days at that $204 rate. So that's going to cost them, what, $2,040. All right, now the third scenario is, of course, the B deductible. Remember what this was? This was everything outpatient related as well as all doctor services. So certainly we're going to see a lot of doctors. So it's not going to be much at all to meet that deductible. But here's what I'm trying to teach you. This deductible can happen more than once in a year. It's tied to a benefit period. So if I'm in the hospital, then discharged, and then if I go back in the hospital 60 days later or 90 days later, sometime later, now I have to go back to the hospital and I would have to pay that deductible again. So it's paid multiple times a year. This deductible on the B side is called a calendar year deductible. And so what do? I only have to meet that once. And so they certainly would have met that B deductible during the calendar year. And then we also have excess charges that we've talked about. Now again, less than 5% of all doctors are doing this. But so what we're going to do, because we know that it can be common whenever it does happen, to happen within cancer care. And so all we're going to say is that of all the doctors that we see, the only doctor that actually charged excess was one, and that was the surgeon. So let's say this surgeon was approved for a surgery, $30,000, lung surgery, okay? And let's say that this doctor does not take reimbursement rates as payment in full from Medicare. That's called a participating doctor or an assignment doctor. So this is a non-assignment, non-participating doctor, and they're going to add that 15% to the bill. And so this surgeon added $4,500 to the bill. All right, so that's our scenario. We were in the hospital twice during this period of time, skilled nursing, 30 days. Had to meet the B deductible, of course, and then we only had one doctor. Of all the doctors we saw, all the oncologists, the specialists we saw, only one charge, and that happened to be the surgeon of $4,500. All right? And so what's going to happen is this. If I start, I'm going to begin this way. If I start with a Plan A, Now, what I want you to see as we talk about Plan A is this. Remember how I said these plans are standardized by Medicare. So what happens is Medicare established what we call basic core benefits. All the plans, all 10 of these have two things, or actually three things in common. Number one, they are going to cover extended hospital stays. Now, in our example, we weren't in the hospital more than 60 days, but all the plans are going to cover this third month, fourth, and fifth month. Plus, what's interesting about all the plans, they're also required under standardized coverage to give someone an additional 365 days in the hospital beyond Medicare, because Medicare only covers us up to 150 days. After that, if I'm still in, during our lifetime, we have an extra 365 days that are paid by the supplemental company. And again, all of those plans are going to do that. All right? And then the other thing that all the plans have in common is this. They will pay the 20% coinsurance. So no matter what plan you go with, you're never responsible for that whatsoever. Okay? And so otherwise, you can see, though, we have 4 gaps that still remain. These are things that Medicare says that you have to decide if you want to get those covered. And again, we're going to look at these different letters to see what type of coverage we're going to have. So let's go through it now. So we have this scenario here, and we're saying we select a Medicare Supplemental Plan A. Now, sometimes people get confused when we say A. I thought the A is the part of Medicare. It is. I wish they wouldn't have done it this way, but they did. And so Medicare Part A is the inpatient side. This is MedSup Plan A. Okay, definitely a difference. And so a company offers you an A. If you buy an A plan, what's going to happen? Well, the only thing that A is going to cover is what they have to cover. And that's these right here. It's going to cover that, but you'd be responsible for all the gaps in this scenario. So when we add all these up and you had a Plan A, out of pocket, you're going to spend $10,044 out of your pocket if you had a Medicare Plan Supplemental A. Why is that? Well, because A doesn't cover the deductibles. We had 2 of those, right? A is not going to cover any of the skilled nursing that 204 you're responsible for. That would be out of your pocket. Remember, first 20 days on Medicare, 10 days out of your pocket. You're responsible for the B deductible. A doesn't pay that. And then A also will not pay excess. So if you had an A plan, you're going to spend $10,044. All right, now let's take a look at Plan B. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us a thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. All right, so let's look at the Plan B, Supplemental Plan B, and how it varies between the A is only one item, and that's this. That Plan B is going to cover those 2A deductibles that we had. So if I have over here this Medicare Supplemental Plan B, what's going to happen? I can eliminate this right here. So remember how we had the $10,044 the out-of-pocket if I had an A plan. So now we can take this $10,044 and we can deduct that $3,264. So let's do that. $10,044. I'm going to subtract the $3,264, and if I had that Plan B, my out-of-pocket expenses now would be $6,780 instead. Why? Well, because that Plan B premium is going to be a little higher, but again, they're going to cover those A deductibles, where if I had the Plan A, I had to pay those out of pocket. So there's the difference between the A and the B. All right, that brings us into the Med-Supp Plan C. Now, before I show you this plan, you have to realize something about this Plan C, and we'll see this when we get to F plan here in a few minutes as well. But that C plan, what happens is this. You had to start Medicare before 1/1/2020 to have a C plan. In fact, the same thing applies on the F plan as well. Different plans, but the point is what Medicare did back in 2020 is they began to phase out the C and F plans. So the way they did that is they grandfathered anyone who started Medicare before 1/1/2020 and said that if you have a C plan or F plan, you can keep those for the rest of your life. So they're grandfathered in. But if you're starting Medicare after January 1, 2020, then the C or the F plan is no longer an option for you, because there are still people that are eligible. I still want to teach those in this video to make sure that you understand. Now, just from a practical standpoint, I can tell you there's very few companies today that are writing new C plans. If a person has a C plan, they can keep it for life. They're lifetime benefits. But it's hard to find a C plan today. But just so you see the comparison, let me show you how this works. The C plan, remember we have these 6 different gaps. What it's going to do, it's going to cover all the gaps right here on the A and B, except it will not cover excess charges. So that's the one gap that you'd be responsible for in this scenario. So again, deductibles paid by the C plan, skilled nursing copays, those extra 10 days covered. The B deductible is going to be covered as well. But that excess charge, $4,500, is not going to be covered by that C plan. All right, so if we had that, what would we be out of pocket? $4,500. Why? Because we had a doctor that charged excess, and we're responsible for that. All right, now let's look at our D plan. As you can tell, I had to erase all my scribbles, so I will start this over again, but to make sure we're real clear on this, if I have a D plan, remember we said earlier, all the plans have to cover extended hospital stays, and all the plans have to cover the 20% co-insurance, regardless of what we buy. So here's the way the D plan is going to work. The D plan will cover the A deductible, so we can cross that off of our list, right? The D plan will also cover our skilled nursing facility copay, so we can drop that off the list as well. Okay, but the D plan will not pay the B deductible. You're responsible for that. And the D plan will not pay the 15% excess charge if and when that ever occurs. So again, you can see 4 of the 6 gaps are covered. So in this $282,000 bill, what's going to happen? I'm going to be responsible for $4,500 and $240. So I got $4,740 that would be out of my pocket, primarily because I had a doctor that added excess. So that's the way the D plan would work, again, on that $282,000 bill. All right, let's take a quick look then at the F plan. Again, this is just like the C plan. What happened? I had to start Medicare before 1/1/2020 to be eligible to get the F plan. There's some of you that could still apply. Now, the neat thing about the F plan is it truly is full coverage. So what happens here is it's going to cover all the gaps. Everything on the A is covered, and everything on the B is covered. I've sold lots of those through my career, so I have clients that are on them. And so we always told the clients who bought the F plan the same thing: if you ever get a bill, do not pay it. Call us and let's figure out why you got the bill, because you should never get a bill on an F plan. If Medicare covers something, then the F plan follows all the gaps 100%. So you, of course, have to pay your premium, but there should be no out-of-pocket expenses for anything medically related to A or to B, because the F covers all the gaps. So in our scenario here, it paid, of course, A deductible, skilled nursing, B deductible, excess. So what was our out-of-pocket expenses other than the premium to have the F plan? Totally zero, a full coverage plan. In fact, let me just kind of share with you, that's why we no longer have them, because the Medicare actuaries realized there was a lot of overuse of F plans. It was costing the government a lot because the government pays first, F plan pays second, and the actuaries finally got their way and said, hey, we want there to be something in the kind of skin in the game beyond just paying a premium, because we don't want anyone to have full coverage plans. And so that's why they eliminated the F plan as well as the C plan back prior to 1/1/2020. All right, so that's the way the F plan would work if you had a $282,000 bill. All right, that brings us into the G plan. Now let's talk about the G plan. Now I went ahead and left this up here because I wanted you to know, if we get the F, remember we had to start before 1/1/2020. So now what's happened is this particular plan here has become the most popular one for people that are starting Medicare after 1/1/2020. It's actually the G plan. All people today buying supplemental plans, 70% of them are getting G plans today. All right, and so this is the most comprehensive plan. So how would it work? Well, very similar to the F, except one item. We'll have to erase this one because that G plan will not pay the B deductible for you. You would be responsible for that. And that's an annual deductible, so you pay it once a year. It's to anything on the B services. Remember, this is everything outpatient that you do: labs, MRIs, CAT scans, outpatient surgery, all the doctors that you see in their office or they see you in the hospital. The first $240 is going to end up as a bill in your mailbox. All right. Then after that, we have 100% coverage. So that's the way the G plan works. So in our $282,000 bill, what's it going to look like? Well, again, that gap's covered. Skilled nursing is going to be covered by the G plan. Now, this is not covered, but excess is covered by the G plan. So when it occurs, so that's why a lot of people like the G plan. It's the most comprehensive one today, because all you have to do is once a year meet that B deductible. And that B deductible resets every January. I don't know what it'll be next year. I'm shooting this video. It's August 1st, 2024. I don't know what it'll be in 2025. It could be up, could be lower, higher, varies year to year. But you just have to meet that once a year. The first $240 is out of your pocket, and after that, 100% coverage. So, $282,000 bill, what's going to cost me this year? It cost me $240. Everything else is covered by Medicare and then by my G plan. All right, that brings us then to the letter K. All right, now, again, I had to erase my board. We had too many scribbles. So just as a reminder, we said all plans standardized by Medicare have to include basic benefits to cover extended hospital stays for these 60 days. Got to give you 365 days in the hospital, and they have to cover the co-insurance of 20%. Okay, so that's the basic core benefits. Now the K plan, what it's going to do with the rest of the gaps is this, very unique. It actually covers 50% of the A deductible. It covers 50% of our skilled nursing daily copay, right now $204. It will not cover the B deductible. That would be out of your pocket, and it will not cover excess. All right, and so a couple 50% and then some 100%. And so as we look at our bill and our case study here, A deductible, it pays half of it. So that means we'd have to spend what, $1,632 out of our pocket. Skilled nursing, remember, it covers half of it, so we can cut this in half. So we'd be responsible for $1,020. We have to pay the full B deductible, and we have to pay excess charges when they occur. All right? And so if you add that up, what happens is this. That number is $7,392 that you would have to spend out of your pocket. But here's what's unique. On the Plan K, they set an annual max out of pocket every year. This year, 2024, it's $7,060. So although we'd be officially responsible for that because the Plan K has a max out of pocket, that's all we would spend. All right, so that would be the Plan K if you had a $282,000 bill. Hey, if you've come to the place where you know you're gonna have to make some Medicare decision pretty soon and you wanna make the right one of the best ways to do this is to go down below, and you'll see in the comment section there, the very first pinned comment at the top. You can actually click on the link there and you will book a call. And you'll book a call with one of our Medicare guides. All the guides with our company, I have personally trained them. They're professional, they answer all your questions, and they'll show you your Medicare options so that you'll be confident in your decisions. Let's get back to the video. All right, that's gonna bring us then to the L plan. Now, what I did on purpose is I left our numbers up there from the K plan to the L plan for this reason, because the difference between K and L are just two items. Here's what happens. On that L plan, your A deductible is covered by the L plan at 75%. 50% on the K, but 75% on the L. And our skilled nursing copays, remember the K covered at 50%. Now that plan will pay at 75%. Again, basic benefits are all the same. And then with the L plan, you're still responsible for the B deductible like you were on several of the plans, and you have to pay excess whenever that occurs. All right? And so it's just a little bit of a stronger coverage. Of course, the premium is going to be higher as well. All right, so let's go to our case study then. So what happens, A deductible, we said it's going to pay 75%, so all we have to do is cut that in half, and we know that we're going to be responsible for, and I did some of the math in advance, $816 on my two deductibles on the A side. Again, we can cut this in half as well, and so they'll pay 75%, we pay 25%, so now I'm responsible for $510 for that extra 10 days of skilled nursing coverage. This is the same, not going to change. I still pay the full B deductible. Once a year, I pay the full excess charges. And so on this one, out of pocket is going to be responsibility of $6,066. But here's the difference. Remember how this had a max out of pocket at $7,060? On the L plan, it's half of that. So that's going to bring us down to $3,530 out of pocket if we had that L plan and we had a bill of $282,000. All right, that brings us then to the Supplemental Plan M. Almost done. Plan M is going to work this way. Just like the K plan, it covers 50% of the A deductible, right? It will cover all this. Why? It has to, standardized by Medicare, just like it has to cover that. And then also with the M plan, it will cover all those skilled nursing copays. It will not be out of your pocket. So 50% of the A deductible you pay the B deductible, and you pay excess charges when they occur. So back to our slide here. So A deductible, I'm responsible for 50% of that. That was 2 hospital stays, cost me $1,632. Skilled nursing, all covered by the M plan. B deductible, I got to pay that, and I got to pay my $4,500 excess charges. So if I had an M plan, I'd be responsible for $4,500, $240, $1,632, and I'd be out of pocket $6,372. All right? And so if I had that big bill and M plan, that's the way it's going to work. All right, that brings us into our final plan, the Supplemental Plan N. Again, same scenario, of course. Now, here's the way the N plan works. N is going to cover, remember these two because they have to, but also N will cover the entire full A deductible. It will cover skilled nursing facility fully. It just doesn't cover 2 gaps, which would be the B deductible and excess charge if and when it occurs. But in addition to that, what happens is this. N has a couple of small copays. And so what it has up to a $20 copay anytime you see a doctor. That could be a primary care doctor, a specialist doctor, anyone you see, $20 copay, no more than that. And then whenever I go to the emergency room, it's going to cost me $50 to the ER, okay? So all we're gonna do in this example is this. We are going to have to add some copays. Now again, this is going to vary. And so I kind of want to keep on the low side, very reasonable side. Let's say that during this period of time, someone goes to a doctor, variety of doctors, oncologists, specialists, primary care, a lot of doctors, but let's say they see a doctor 15 times, which is probably about average right now for someone that's undergoing serious cancer treatment. So we'll say 15 visits, and that would be at $20, and we'll say they never have to go to the emergency room. If they did, they'd have to pay a $50 copay for that. Again, very reasonable. All right, so if I had the N plan, we can see It's going to cover my A deductible, 100%. Don't have to worry about it. Skilled nursing, again, covered fully by the N plan. Now in the N plan, I'm going to have to pay my $240 because I have to meet my deductible. No big deal, just once a year. And you'll notice the N plan will not cover excess. We said most of our doctors didn't, but the surgeon did. So I would have to be responsible for that $4,500 if indeed I saw or had a surgeon that charged the excess fees. In addition, we said we had 15 doctor visits during this time. So that would be an additional $300 out of my pocket. All right. And again, it could be more, it could be less than that. We just want to give you some realistic kind of a number. So copays meet the B deductible, excess charges. So when we add all this together, we got $4,800, we got $5,040 out of pocket if I had a $282,000 bill and I was on the N plan. All right, I sure hope that was helpful. A lot of information I know, but a lot of people ask about these different plans. So let's just talk though about the top 3 plans that people are buying right now. Number 1 plan as far as coverage goes would be the F plan. Why? Because that was 100% coverage for sure. But what happened? Anyone that's starting Medicare 1/1/2020 after, ineligible to get that F plan. So most of you could not. If you could, not a problem. Now I will tell you this, in my opinion, the F plan is not the best value today. You're paying a lot of extra money in premium for one additional benefit. Why is that? Well, because the G plan today, again, 70% of all people today buying supplemental plans are getting G plans. It is covering 5 of the 6 gaps, everything but once, what? The annual Part B deductible, which is $240. And so that's the only difference between these 2 plans is that B deductible. So if I'm paying an extra $50 a month for my F plan, which is about average, I paid $600 a year for the F plan, and what did I get out of it? It paid my B deductible. So you just overpaid for that benefit. So even if you could qualify for an F plan because of when you started Medicare, I still think your G is your best value. Again, that's what most people are buying. It's the most comprehensive plan. All right, now the next popular plan would be the N plan. And again, about 30% of all people buying plans today get the N plan. And I want you to know, I think they're both wonderful. Okay, I don't think you can make a bad decision either way. The difference would be the N plan is going to cover 4 of the 6, right? You got to meet your B deductible on the N plan. And if and when excess charges happen, you're responsible for them. Again, it's not often, less than 5%. And then remember, we had a couple copays, $20 to see a doctor, $50 to go to the emergency room. So you can decide how many times you think you'd go to the doctor. But the whole point is some people go with the N plan because it's going to be less expensive. Now, folks, I want you to know this. We are a nationwide broker. We write in all 50 states and the District of Columbia. Okay, so I'm going to share some rates with you just as average. So your state could be different for sure. But on average right now, we're seeing about a difference between the G and the N of about $30, maybe $35 a month. Okay, so what would that be savings in a year? Somewhere between about $360 to what? $420. All right, that would be the difference. And so what's the difference? Got some copays to see the doctor, excess charge if and when that occurs. Some people say, hey, that extra money is not going to make me or break me. I would just soon have the most comprehensive coverage available in the market. Then that would be the G plan. Others say, you know, I rarely go to the doctor. I know this doesn't happen often. I just soon save the money, and then they'll go to the N plan. I promise you, both are good. I don't think there's a good, bad, or better or anything. I think it's just a matter of your preference. Some people are willing to take on a little bit more risk. And again, it's not a whole lot more risk, but it's a little. All right? And so the whole point is these are your top plans today. Most of you couldn't get this anyways because you're starting Medicare after 1/1/2020. And even if you could, I think the G or the N would still be your best buy. All right? And so I want to clarify something. I want you to know there are some states where that is higher. Few states where it's substantially higher. And when it's substantially higher than the 30 or 35, then we encourage people go with that N plan. Why? Because excess doesn't occur often. All right, now I live in a state where excess can occur. I am very, very close to Medicare eligibility in the state where I live. I live in Missouri. Our office is actually in Kansas, and of course we're nationwide. But the point is, this is what it is right here where I live. And that's what I'm going to go with when I go on Medicare. Just because it's minimal, that $30 or $35 a month is not going to make or break me. I don't know what excess is going to look like in the future. Maybe more doctors are going to cover that, but that extra $30 or $35 in savings to me would not be worth that additional risk. But again, if you're comfortable taking on that, it is not a bad decision, please. I think G and I think N are wonderful, wonderful plans. You have to decide what you're comfortable with. And we would love to have the privilege to walk you through the process because regardless of whatever plan you go with, F, G, or N, we want to make sure that you go with the carrier that is proven to be stable, because again, rates go up, but some companies have rate increases more frequently, more drastically. We want to avoid those companies and find a plan that's good for you, that's a good fit for you, but a company that's also proven to be stable.